Healthcare-related pressure ulcers affect 1.6 billion patients in the United States at a cost of $2.2 to $3.6 billion. Now, 12 to 66% of those patients acquired their ulcers during a surgical procedure, according to an AORN journal article written by Mike Primano. Research suggests that the prevention of the formation of a pressure ulcer during a surgical procedure is a necessity. The impact of a pressure ulcer on a patient increases their pain and suffering, increases their recovery time and the length of stay in the hospital, increases their use of hospital resources and costs, and Medicare and Medicaid may or may not cover these costs. So it is our responsibility as a surgical team to provide an optimal and safe surgical experience for our patients by properly positioning our patients, by using our positioning aids in the appropriate manner, and by using devices and aids that have been provided to us to pad and protect our patients. Some intrinsic factors that have been identified by Joshua Lumbry in the Journal of Clinical Anesthesia are age, high or low BMI, mobility, and poor circulation in the patient. Kathy Beck, the wound, ostomy, and continence nurse at Sentara Williamsburg Regional Medical Center, where I am employed, also provided me with a list of intrinsic factors that affect our patients. Age, she also listed the very young and a patient over 65 years of age. A Braden score of 18 or less, which is a skin assessment. Nurses look at your patient's skin, assess whether they already have something going on. Look, take the time and look. The patient's nutritional status, are they very thin and emaciated, or do they have a high BMI and obese? Both of these types of patients are at risk. Does your patient have a comorbidity? Are they a diabetic patient? Do they have vascular disease? Are they on vasopressors? What is your patient's mobility level? Are they ambulatory or are they bedridden? Also, you need to consider the length of your surgery of your patient. 2 hours and greater is enough to start the cause of a pressure ulcer, as noted by Kathy in my visual aid. Now, Joyce Black in Wound International also identified that the length of surgery is a major factor in the development of pressure ulcers. At Sentara Williamsburg, we had a couple of very healthy 40, 50-year-old patients with no comorbidities, but because of the length of their surgery and the combination of time between pre-op, surgical, and post-op, they developed pressure ulcers. One patient had a 15-hour surgery, and he developed a stage 1 pressure ulcer. Now, the location of the pressure ulcers vary due to the position of the patient, and we generally position our patients supine, prone, in a lateral position on their sides, or in lithotomy and stirrups. So the areas that can develop a pressure ulcer are the sacrum, the heels, the top of the foot, the toes, knees, elbows, forehead, nose, chin, the back of the head, the upper back. Any of these areas, depending on the position, also the iliac crest and the chest, can develop a pressure ulcer. Now, we can't really move our patients other than the anesthesiologist can maybe shift the head slightly, but we can't move our patients during surgery. So there have some devices that have been developed that help us pad and protect our patients. Now, these devices are called Mepilex, and they're heart-shaped, which helps cover the sacrum and buttocks, and they're also cloverleaf shaped, which also can help protect the sacrum. But the cloverleaf Mepilex is fantastic for using on the heels, for covering the elbows, for covering the knees, the top of the foot, wherever you think the patient may need it. You can also use gel pads, gel head rings, and for extra protection we have air cushions that can go underneath the patient, whether it's their lower back or upper back, on their sides. And we have air pads inside of booties that, if their procedure allows, that can protect the patient's foot during the surgical procedure. Now, Repic who documented in Acta Medica Mediane, if I pronounce that correctly, that the impact of a pressure ulcer on the patient impacts their quality of life. It impacts them emotionally, physically, psychologically, and financially. The emotional impact and the physical impact go hand in hand. A patient with a pressure ulcer can become infected. This can be very upsetting and very distressing to the patient, not to mention very painful. If the patient becomes infected, it can be malodorous, and then the patient is embarrassed, and they will end up being socially isolated because they don't want to be around people if they don't smell very well, very good. So patients are impacted psychologically. The financial impact on a patient, according to Joshua Lumley, can be tremendous. A single pressure ulcer can cost anywhere from $2,000 to $70,000. For a hospital, annually, the cost of pressure ulcer treatment ranges from $400,000 to $700,000. And Medicare and Medicaid may not pay. Medicare and Medicaid, according to Lumley, have determined that there are 28 preventable serious events, and a pressure ulcer is one of those serious events. So they have determined that it is better to prevent pressure ulcers than to treat pressure ulcers. So they may or may not pay. Now, sometimes Medicare will pay for stage 4 and 5 pressure ulcers, but it depends totally on the documentation that is in the chart for that patient. So, research suggests that prevention of a pressure ulcer is a necessity. The impact on a patient is increased pain and suffering, increase of costs and hospital stay and recovery time, increase emotionally, physically on this patient. And it is our job as a surgical team to help prevent this from happening to our patients. It is our responsibility to give the best care that we can. And I hope that I have provided you with some information and some tools that you can use that will impact your practice and provide a safe and optimal surgical experience for your patients. Thank you.